So we've got my brother here as our patient this morning.
Can you erase that? Can you start over? Can we just start over?
No, sorry. And our topic with my brother Dan, we're talking about two things. One, just general skincare health, skin health, sun protection, and then skin cancers. He has, both of us, we have similar kinds of skin and we tend to grow things, and he's had a bunch of basal cells. He's in the second half of his 40s, and you probably started getting skin cancers in the end of your 30s, maybe?
That's just about right.
Yeah. We were just having a discussion before we started filming about the importance of sunscreen and finding a really good one that feels good. He's tried a couple, and the reason he's not wearing it was because they make his skin white. So that's a really classic response, trying to find the right product that makes you actually want to wear it every day. And that would really kind of minimize his pigmentation and also the chance of him having skin cancers in the future. So first we're going to take care of what we know as a basal cell on his cheek over here. That's going to be an excision, and then we're going to do a TCA peel. It's a 30% trichloroacetic acid, and the purpose is to rid the surface of all of these. He's got some actinokeratoses and superficial pigment. So it's part of it is aesthetics. His wife will tell you that she doesn't like all the darker spots. So it'll help with the texture and tone of the surface of the skin, but it will also remove the precancerous lesions and decrease the number of skin cancers he has in the future. So this is your second TCA peel. Probably maybe 6 months ago, a year ago?
At least, maybe a year ago.
Maybe a year ago. So it's someone who has skin like this, it's something that you could do a TCA peel a couple times a year actually to stay on top of prior skin damage and to decrease the skin cancers that you get down the road. So that's our plan for today. Ready for round two. This is where his excision was. Got rid of a little basal cell there. And now we just degreased his skin with acetone. That's the first step of the peel. The second step is what's called Jesner's. And you can just do a light Jesner's for skin rejuvenation. But the point of the Jesner's in the setting of a TCA is to make sure that we get good even penetration of the acid. So this is our first step. And we were just talking about where we're going to treat. We're mostly going to treat the upper half of his face, but also his lateral cheeks and the part of his neck. Basically, we're going for the areas where we see most of the sun damage.
Is that going to take that pigmentation away?
Yeah,
that thing right there?
it'll lighten it substantially. Yeah. Do I have some 2x2s? Okay, this isn't good, right? Thanks. And Sarah's at the ready with her fan because it can make it a little more comfortable. Even the Jesner's it feels like something's happening. And he can feel kind of sensory. The places where the most sun damage is actually the place where it hurts the most. So he'll feel kind of places that he feels are like hot spots.
The whole thing hurts.
Yeah. And we're going to set a timer. Set a 2-minute timer.
Okay.
So this was, right here we're doing round 1 of the TCA. I don't know how well you can see it, but where we treated, it's starting to turn a little bit white. We call that frosting. And that's how we can see how much penetration we're getting. Set a 2-minute timer. So we wait for round 1, and then we'll see if there's areas that we can treat with another level. Sometimes it can actually, people can take up to three layers of a TCA. And it really just depends how much skin damage there is and how their skin responds. But this white color change is exactly what we're looking for. This is that area of pigmentation that he was asking about. And so for the next level, we'll kind of get those spots a little bit more. Treat them a little extra. He did ask between levels if we ever give people anything for sedation, like some Valium or something to take the edge off, and we can do that as long as somebody has a driver. It just makes people feel a little bit more relaxed.
See, I would need it for the biopsy.
The biopsy bothered you more than the peel?
Oh yeah, I mean,
really?
this hurts, it burns, but it's not like, it doesn't stress me out.
So the excision's just, it's an emotional response.
Yeah.
It's not that it hurt.
No, it doesn't
You just
hurt
don't
at
like
all.
the idea of it.
The whole tugging of when you're suturing,
Yeah?
that drives me bonkers.
Just because you know it's happening, you can envision it.
Yeah, I know exactly what you're doing. It'd be really nice to have this just taking a nap.
How would that work?
Someone just fan your face while you're taking a nap.
Oh, you mean just this, not the acid, but the Sarah holding a fan on you?
Yeah, just that.
We can get you one of these.
A Sarah?
No. You already have a Sarah.
Yes.
My Sarah would never do this.
I mean, I can get you a fan for Christmas. Why we wait a little bit between layers is I want to see the full response so we don't overtreat any areas. Overtreatment would result in a part that would take some time to heal. We don't want that to happen. The most important part of this is that afterwards that he doesn't pick or pull or peel the skin. It has to, so the longer it stays on, the more opportunity for those new cells to recover underneath. And for a lot of people like Dan, people want to get back to exercising as soon as possible, and really, you can't really get your sweat on for a good 3 to 4 days. What would happen is that you would make that bubble up, your sweat glands will create sweat and you get fluid underneath the skin, and it makes the skin come off more quickly. So 3 days is enough time for most of that healing to happen, but people still will get some bubbling with some exercise. How you doing?
Me?
Yeah.
I'm alright.
Okay. We're almost there.
Doesn't feel very good.
Yeah.
This is gonna tighten my skin up, make me feel younger.
Yeah. I don't know if it'll make you feel younger, but it'll make you look younger. Stretch here. I'm just getting a couple little spots that. minute, we're gonna be done. So our end point here is that we can see the spots that we were really worried about are nice and white. And we actually just use sunscreen to neutralize it. So this is just a physical block. And Dan can tell you that as soon as I put it on, it actually starts to feel better right away.
Are my eyebrows gonna fall off?
No, just the skin. Just the skin. Nothing's gonna fall off. And after I get this on, he'll be able to tell me if there's any hot spots that are still bugging him. But hopefully you're starting to feel better.
A little bit.
Yeah.
It's funny, the neck hurts almost
Yeah,
more
the
than-
neck does hurt more. Yep.
Do people cry during this?
Sometimes.
I'm crying on the inside.
On the inside.
If there weren't a lot of people here, I'd be crying.
Yeah. Sometimes we do a little nitrous oxide. If someone's really worried about getting through it, that can help a lot.
Does that make you pass out?
Just it's self-delivered, so you have to have a seal around your mouth to make it work. Any places that still feel really hot?
Around my brow line, hairline.
Up here? Or on
Yeah.
the sides?
The sides and the neck.
Nitrous just makes it doesn't actually make it,
Makes you not care
it
about
makes you
it.
not care about the sensory. So it relaxes most people, and it's almost like taking like a muscle relaxant, except that it's easy on, easy off. It's only working while you're breathing it, and then you recover right away. Any place now?
No, I think that's good.
Okay.
Here in my nose. So this is a deep chemical peel?
Mm-hmm.
What are the small, like the superficial ones?
So there's it's a good question. There's a lot of different layers. I always think of there's basically 3 levels of peels before you get to TCA. But the general idea is meant to stimulate collagen and exfoliate what's on the surface,
Mm-hmm.
and so it's just less penetration. You could do, a
Well,
really low level peel multiple times. Why people choose that rather than this is because of the downtime. This will take you a full week to heal, whereas you could do a series of lower level peels like once a month. Then over 6 months you'd get kind of to the same place.
Doesn't hurt as much?
Doesn't hurt as much. It's, less penetration, less pain, but less result.